I will give a shortly and briefly introduce of our experience in Wuhan. So, our ward is a newly established ward for COVID-19 in Wuhan Tongji Hospital. So we have 6 ICU beds and 44 beds for severe cases. So we started at February the 4th. So we have 100 COVID-19 patients together. There are 4 patients died, and we have all the patients succeeded to survive. So we have isolated rooms to avoid cross-infection. We think there are three factors, very important factors, in hands-on so many patients. The first is environment and equipment. So we have many rooms and monitors for the patient vital sign and organ function to monitor. And we have ECMO, high flow ventilator, and Nosocomial to life support. And we have to make the patient to CVC and PICC in section. So we have another equipment for test the ABG, broadcaster, and ultrasound ECG, and so on. This is a device. All the devices are brought from China-Japan Friendship Hospital in Beijing. Some are donated by manufacturers in this emergency. So the important equipment we wanted to show is a critical care ultrasound. He can give the patient the diagnosis for the substitution for CT, and the second, he can screen for the patient to predict which patient is most severe or most critical care. And the third is a point of care ultrasound. And the last is a whole body ultrasound to make the patient management. So we have the experience team member or colleague. So we have 1 team leader, 4 coordinators. There are 30 doctors, including attending, fellows, and residents. Most of them from Department of Internal Medicine. And very important is PCCM. PCCM including 3 attendants and 6 fellows. So we also have almost nearly 100 nurses, including 17 nurses from ICU. And we also have 1 RT and 1 specialist for infection control. The team is very experienced with ECMO. We have detailed doctor and nurse shift, day and night shift, to make sure they have enough energy to fight the COVID-19. And the last is the standard procedure. The procedure is most important and critical care to save lives during pandemic and emergency, including CPR, including CVC section, including ECMO checklist, and so on. So this is we will prepare for the important device to handle to avoid delay. And we have the experienced team and the SOP to make sure the safety of the patient. And all the procedure, all the Nosocomial and PCD and intubation, we all have the standard procedure to make sure the safety of the patient. And what the patient received, the respiratory support, especially more than high flow and non-invasive and invasive patient. So we give the patient the vital sign, including SpO2 and ABG. And we also give the patient the respiratory support level. And we want to emphasize the patient respiratory rate is useful to evaluate the patient compensatory ability. So we can take this measure to treatment. We don't know what drugs is most useful for anti-SARS COVID-19. So maybe Dr. Cao Bing give our more information. So corticosteroids is also useful for the patient treatment. And the patient ARDS is not very typically from the normal ARDS. And the last, but not the infection control is most important for the epidemic. So mental care for both the patient and the doctor is also important for all the patients and all the doctors who attended the battle. So this is our team experience for against the COVID-19. So thanks for your listening.